UroPatient. Tune in and see. Power your health for you and me. Knowledge is power. Power. We make it clear every Saturday morning.
So here's one of my favorite things to do. I've done it every year since I started, and that's to look through what new things are going to be coming out in 2026 that may affect your life. Here's one I think is pretty cool, the InnoCare's Egress Safety Catheter. It's a breakthrough in patient care as it's the first urinary safety catheter designed to automatically deflate if pulled out with the balloon inflated. I can tell you, we've taken care of many a patient with a lot of bleeding when they accidentally pull that catheter out and it comes through with that big old balloon that you see there, still inflated. Well, this is, by the pulling force, activates a secondary deflation mechanism, automatically deflating that balloon, the one that we see over there, prior to a forced removal. Now, this device is FDA cleared under a new classification for Foley catheters with additional safety features. It's the first device ever to be using this new code, so it's really cool. I saw it over in a meeting just recently in Louisville, Kentucky, when I went to the SUNA meeting. And I tell you, I was blown away when I saw it. It's really going to make a difference. Okay, here's another one. The Zeta Control Sock. And I'm kind of in the way of the sock. You can kind of see it there now. It uses a transcutaneous posterior tibial nerve stimulator. That's a nerve in your ankle to treat overactive bladder. That's when you get that I gotta go symptoms, like frequency, urgency, and maybe even leaking urine. So the electrodes are embedded in the sock that delivers a gentle electrical pulse to the tibial nerve, which controls bladder function via a small battery-operated control unit. This non-invasive at-home therapy works by retraining your bladder nerves and may reduce the need for constant trips to the bathroom. So how does it work? Well, the sock is embedded with those electrodes that stimulate that tibial nerve that run from the ankle to your back. The control unit sends electrical pulses, and the patient then feels a tingling, the patient. You feel a tingling or gentle vibration that you can adjust to get your comfort level. You might see your toes twitch a little bit, or you'll feel a tickling sensation. It's often used for 30 minutes a week for 12 weeks initially, with an initial adjustment period to find just the right settings, and I've got a little video on that.
We are ready to begin the treatment process. Clean and prepare the treatment site by washing it with soap and water. Gently dry the site. For increased performance, you may choose to apply conductive electrode gel. The gel should be applied directly to the skin at the treatment site. Now, put on the sock as you would any other sock. Make sure that the toe and ankle area are lined up properly and pull the sock completely up on your leg. Make sure that both embedded electrodes are in direct contact with your skin. One of the electrodes is located between the ankle and the toes, and the second is on the inner portion of the leg a couple of inches above the ankle. The electrodes are located underneath the smooth plasticky patches in the sock. Attach the Zeta control unit to the control sock. The snaps are magnetic and can only be attached in a single direction. You will hear a click as the device attaches. The therapy can only be delivered once the device is properly attached. Now you are ready to turn on the device. Simply hold down the power button until you see the unit flash green. During test mode, you can adjust the levels of the therapy. Simply push down on the plus and minus buttons until you feel comfortable with the intensity of the therapy. We recommend holding down the plus button until you feel the therapy being delivered. You may experience a tingling feeling in your foot and or toes. If you don't feel anything, that does not mean that the therapy is not being delivered. Therapy mode comes directly after test mode. It is indicated by a flashing green light. Therapy mode lasts for 30 minutes, which is the duration of the treatment, and will shut off automatically once the treatment is finished. To ensure steady treatment levels throughout the 30-minute therapy session, we recommend moving around as little as possible. The Zeta control sock should be used for 30 minutes a week, once a week, for 12 weeks.
So there you have it. Pretty interesting. Here's another thing called the Dry Q. It's an innovative monitoring technology that transforms senior care with real-time solutions for family and healthcare providers. So what's this do? Dry Q Health's monitoring technology is a smart, non-invasive system designed to transform how incontinence care is managed in senior living, home care, or clinical settings. At its core is a thin, battery-free sensor that adheres to the outside of any adult brief. No special diapers, tubing, suction. It uses radio frequency system to detect moisture instantly. Now, once the moisture is detected, DryQ immediately sends real-time alerts to caregivers' phones, tablets, or nurse station dashboards, enabling them to respond promptly, often dramatically reducing the time somebody would be sitting in a wet brief, thereby lowering the risk of skin breakdown, discomfort, or infections. Beyond just wetness detection, its platform can integrate additionally to monitor functions such as mobility tracking, fall detection, getting out of bed, going out what they call a geofence, like walking out the door if somebody was confused and they took off, offering a more holistic, data-driven approach to senior care that emphasizes both safety and dignity. Importantly, because the sensors are maintenance-free and harvest energy via RFID from the reader hub rather than relying on batteries, the system is easier to implement and sustain, which can lower ongoing costs and reduce caregiver burden. Pretty cool. I think it's worth a try. Coming out 2026. Here's another thing kind of crazy. It's called Glean. Now, I used to do a lot of urodynamics tests during my career, and it's never been the best test because it's taking a snapshot of one point in time. Well, you're at my office and I'm putting all these catheters and tubes in you, and myself is in there, maybe somebody else too. Not really the best way to do it. Well, the Glean revolutionizes this using a wireless catheter-free technology, and the purpose is to improve comfort, streamline clinic workflow, and gain better real-world data. And that's the most important, real world. As you can kind of see in this picture over here, that's a little thing is placed inside your bladder, and you go home with it. It's got a string so it can be easily removed. Don't have to go in there with any invasive things to grab it. But here's a little video on that. Bladder. Pretty cool. Beats going through that test the other way. Here's another new one. It's not a new drug, but it's a new use of a drug that's been out for a little while called Gemtesa, or Virbegron. It's our fancy generic name for it, but it's FDA approved for adult men with overactive bladder. That's what it came out for originally. Now here's the new thing. Overactive bladder with people that are already taking medications for an enlarged prostate known as BPH. So if you've got prostate issues, your prostate's gotten big and you're taking something for it, you may get relief from that, but you may still feel like you're going to or have the urge to go to the bathroom a lot, because sometimes that large prostate can irritate the bladder, making you get that I gotta go symptom. Throwing this beta-3 agonist called Gemtesa into that will help to calm those things down. So now you got something to not only open your prostate up, but something to calm your bladder down, really reducing those urgency and frequent urination trips. Here's a cool thing. Got a big prostate? This is the ProArc. Now we're coming up with all different methods to try to open up the prostate, what we call minimally invasive technology. Well, the Omega implant from ProArc Medical is an innovative, minimally invasive treatment for BPH, big prostates, associated with blockages of the system called lower urinary tract symptoms. The system uses a special delivery device to place an arc-shaped tissue-embedded implant into the prostate tissue via a little cut and an incision. around the prostatic urethra. Quick procedure, often completed in about 3 minutes under just kind of minimal anesthesia, some numbing stuff and relaxing stuff. And well, here's a video to show you.
And causing urinary symptoms. So we insert our device into the obstructed area through a cystoscope and under direct vision. The delivery system is based on a balloon that deploys a pre-shaped nitinol implant into the implantation site and expands the surrounding tissue, bringing it into a desired shape and size. In a very fast and simple procedure, the urologist performs a circular incision and place the implant inside simultaneously, just like that. At the end of the process, the delivery system is withdrawn, leaving the implants to expand the obstructed area.
That's pretty cool. I gotta tell you, I haven't seen any of them done yet because, again, this is the new technology just coming out. But that may be something in the future. It could be really a quick, simple way to help get that prostate open permanently. All right, here's something called bladder care assay. It's a non-invasive urine test designed to help monitor bladder cancer by detecting specific molecular markers associated with tumor activity. For patients, this can mean a simple urine test, often collected at home or in the clinic, can provide valuable information about the risk of bladder cancer recurrence. So this is somebody who's already had bladder cancer diagnosis, and as most of you that have had it done, you know that you're coming back for routine cystoscopies, looking into the bladder with a scope. Now we might be able to cut some of those out by doing this quick urine test, potentially reducing the frequency of the invasive cystoscopy between office visits. As part of a more home-based, patient-centered approach to urologic care, bladder care assay offers greater convenience, less discomfort, and added peace of mind while supporting earlier detection and closer surveillance when used alongside standard urology follow-up. Hey, this is one that we talked about a while back, but it's worth mentioning again. Quick Change Urinary Management System. It offers a streamlined, patient-friendly approach to bladder care designed to simplify catheter or incontinence management while maintaining comfort and hygiene. This system emphasizes ease of use, efficiency, and safety, making it ideal for both home-based and clinical settings. By reducing handling complexity and promoting consistent, reliable care, Quick Change helps patients with caregivers manage urinary needs with confidence, dignity, and improved quality. I got a little excerpt from the video that we did a while back with Kimberly, who came in from that company, did a great little demonstration on it. This thing is kind of neat because typically when you're doing a diaper or some kind of absorptive device for a male, you got to like roll them over or something to change it. This one you don't. Today we got a really great show. I got Kimberly Anderson from the company that makes a product. I got it right here called Quick Change. Now, this is really an interesting product. It's was developed for people that are having issues with incontinence, and maybe you're wheelchair bound or something like that, so it's harder. Let me step back here a little bit. And she's going to demonstrate how this works, but it's a really simple way that you can contain male incontinence, and change it super easy. That's why they call it Quick Change.
See that it is a one shape, one size fits all. It is latex free, holds 500 mLs, and it dries to the touch in less than 2 minutes. So in looking at the wrap, it is made with super absorbent polymer beads into the core section here, which is going to absorb all of that urine and moisture and wick it away. It has a very heavy wicking technique also. When you're profiling your patient, this is for minimal to non-ambulatory, bedbound and wheelchair-bound patients. And we are going to show you that this one size, this one shape is going to address those that have a shaft, that have little to no shaft retracted, indwelling, and also for bariatric patients where it's actually the genitals are hidden under the pannus and can be actually protecting that pannus as well by using the wraps. So what we have here is our little dummy, and we have the waist up here and the feet down here, and we are going to apply the wrap with the print side to the skin And consider these little wings, think of them as legs. You want them going in the same direction as the patient's legs, okay? So I'm going to pull the white side up, pull the legs, these wings going in the same direction, right down into the head and the neck of the shaft here. Now, from a relaxed position, you are going to pull the genital right up on the wrap there. And the tip to this is to keep 2 to 3 inches from the head to the top of the wrap. So if he's more well endowed, you're going to slide this down the shaft in order to get that distance. For this gentleman, we'll pull it right down here. Now, you'll notice that there's a point side and a straight edge side. And that's to remind you that you'll always pull the point side first, because on the straight edge side here is your fastener, and that is what's going to hold everything together. Now, it's called the quick change for a very good reason. You're going to be able to change him in less than 60 seconds, and it's only going to take one person to do this. So point side, come straight across the head, align the edges at the top, creating that flat fan shape, hold it in position, take the fastener, pull it taut in the opposite direction, give a quick pinch on the Velcro there, the fastener, and you're done. That's it.
So there you have it. That's a pretty simple device, and it works really well. All right, PS Fertility. It's a U.S.-based medical diagnostic company founded in 2019 and headquartered in Charlottesville, Virginia, that aims to revolutionize male fertility evaluation by going beyond the traditional semen analysis. So if you're having problems with pregnancy, this is a test you may be interested in. So their flagship product is called PS Detect. It's a mail-order test that measures the percentage of sperm expressing the biomarker I'm going to call it PS for you, but it's phosphatidylserine, a critical molecular signal correlated with the sperm's ability to fertilize an egg. So having sperm doesn't always mean you're going to have fertility. According to PS Fertility, a significant number of men with normal conventional semen analysis still have low PS scores, which may underlie unexplained infertility. PS Detects therefore provides additional clinically relevant information that may guide treatment decisions such as varicocele repair or other fertility-enhancing interventions. By offering an accessible at-home collection kit and more precise assessment of sperm fertilization competence, PS Fertility hopes to reduce the burden and uncertainty many couples face on their path to conception. Just another tool for the toolbox, folks. This one here is kind of crazy. Verve Medical. It's a U.S.-based company's early-stage medical device that's a novel, minimally invasive treatment for high blood pressure, hypertension, that does not require chronic medication. Now, isn't that something? You don't have to take a pill. The key technology, the renal pelvic denervation system, or the RPD, works by assessing the renal nerves through the natural urinary tract. I mean, through the transurethral. You see that tube goes up through the penis, up through the kidney, and into the kidney. Then delivers a controlled energy to ablate overactive nerve fibers in the renal pelvis, which can contribute to persistently elevated blood pressure. In a feasibility study, the RPD procedure achieved a mean 24-hour systolic blood pressure reduction of 28 millimeters of mercury. So that's like 180 over 20 would come down to 180 would come down to 180 over 120 over 80. I got those backwards. Sorry, folks. 120 over 80, that's normal blood pressure. It could come down to, if you had a blood pressure, say, a 160 over 100, it could bring it down to that 120 over 80 mark. So in patients, it's used for patients with uncontrolled hypertension despite multiple antihypertensive drugs, people that are failing drug therapy. The company's received regulatory approval from the USDA to begin larger randomized pivotal trial for further testing. Remember, most of this stuff that I'm showing you is looking into the future of what might be coming. And here's one we talked about, but I thought it was worth mentioning again because I'm blown away by this thing. I've been playing with my own system and trying it out, but it's a smartphone-based Uroflow and urinary health monitoring app developed by Soundable Health that allows men, especially those with BPH, weak stream, getting up at night, incomplete voiding, to measure their urine flow just by naturally voiding with your phone next to the toilet. It can figure out how fast the flow rate is. And low flow rate is associated with blockage. Makes sense. I always say if you were taking a straw and tried to blow out a candle, that's normal flow. Now get a coffee stir, you know how thin those are. Try to blow out that candle, you can't. That's restricted flow. That's BPH, folks. This thing can track that flow rate to see. So very simple device, very easy to use, and like I said, I've been kind of blown away. It also does a few other things. It helps you record your intake, the volume, how much comes out when you urinate, some of those things that are really helpful. It'll send it right to your doctor's office, or you can bring the report with you. And it's going to really give him a lot of information. Now, as I kind of mentioned last time, the company's going to collaborate with me to help you save money. I said, I like this system, but is there a way we can, cut my patients, my viewers, a little slack? So they did. They came up with a 10% off promo code that EuroMO10 and YR10, month or year, because they sell it by the month or sell it by the year. You save more money depending if you buy the year versus the monthly. But either way, you're going to save 10% if you go ahead and use those codes that are only available through UroPatient. So you're getting these codes by me. Merry Christmas. Well, I hope that you really enjoyed all this. It's fun to look into the next year, but be sure to join us next year at UroPatient for more expert insights, practical tips, and the latest updates in urologic care. Remember, these are designed to help you, the patient, stay more informed, be more empowered, and manage your urologic health. So don't miss the opportunity to learn more from people like me and other experts that get on the show here to help you with your urinary and bladder health. With all that, have a great rest of your year, and we'll see you next year.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see. Baby, your health for you and me. Knowledge is power. We make it clear. Every Saturday morning, the podcast is here.